When the calls come in, the wheels roll out. And lately, these sirens are blaring down the streets more often.
Any ER across the tri-state area seeing such a vast increase in patients right now.
Here in Florence, EMS Battalion Chief Danielle Steiner says many of their calls are repeats, complications from chronic illnesses like COPD and diabetes, manageable conditions that, if treated properly, could save those patients another trip in the back of one of these.
See what we can do collaboratively to navigate how to keep them from being readmitted to the hospital several times, and at the same time reduce our call volume and going back to these patients repeatedly for the same kind of illnesses that they see.
Florence makes about 11,000 fire and EMS runs every year. It's a big number, and they want to make a dent. So they're hoping this program will help lower those runs by about 20%.
Thanks to a $175,000 grant, the department will hire 2 part-time paramedics. They'll work specifically with St. Elizabeth Hospital nurses. Together, they'll identify chronic patients who might be a good fit and connect them with providers and pharmacies and any other healthcare needs.
Do you really see this as a really big solution here in the community?
Based on what we've seen from other parts of the country and programs just south of us in Lexington, they seem to have an effect. I mean, Lexington's program has grown exponentially over the years.
Assistant Fire and EMS Chief Chris Miller says Covington is joining in too. Because they have the highest call volumes, both cities will pilot the program for Northern Kentucky starting in the new year.
Maybe 3 months, maybe 6 months before we start getting enough data to determine the effectiveness.
Until then, the calls will keep coming, and these wheels will keep rolling out in Florence. Valerie Lyons, WCPO 9 News.